What if everything you've been told about pelvic floor health is only part of the story? In this episode of Mid Month Meeting of the Minds, I sit down with Dr. Sara Reardon, also known as the Vagina Whisperer. She's a board certified pelvic floor therapist and women's health clinical specialist, and she is transforming how women understand their bodies. Hi, everybody. Welcome to this month's Mid Month Meeting of the Minds. I have the amazing, the Vagina Whisperer, Dr. Sara Reardon, physical therapist, doctorate in physical therapy, women's health clinical specialist. She is a pelvic floor therapist. Have you ever heard of that? I'm going to let her tell you all about it, and we'll see where our conversation goes today. Take it
Thank
away.
you. Thanks, Dr. Shaw, for having me. So, I am Dr. Sara Reardon. I am a New Orleans native, mom of two, and also known on social media as the Vagina Whisperer. I absolutely love educating all genders, but particularly women, about their pelvic floor health and the changes that we go through during transitional times in our lives, whether we're menstruating, becoming sexually active, um, experiencing pregnancy, recovering postpartum, and now where I am in perimenopause and then menopause and beyond. I am an author of a book called Floored, A Woman's Guide to Pelvic Floor Health at Every Age and Stage that released in 2025 and is a national bestseller, which is very exciting. And also the creator of an app called the V-Hive app, which has at-home pelvic floor and core workouts for women of every age and stage. So I'm very excited to be here.
I am thrilled you're here, and I think the work you do is remarkable. For my listeners or our listeners, I am actually a retired OBGYN, and when I was in training in the late 1990s, there was no discussion on pelvic floor therapy, none that I really remember. And then when I met you many years ago at a socially progressive happy hour, which neither one of us know even what year it was, I thought, wow, this is what the next generation is going to get, some amazing knowledge. So share with us a little bit, how did you fall into this work? And I read a little bit about your story and how you acquired the title, The Vagina Whisperer, but share with us what you feel like.
Absolutely. So I went to Washington University in St. Louis and I got my doctorate in physical therapy there. And while there, I had a professor, her name was Dr. Tracy Spitznagel, who gave us a couple weeks lecture about pelvic floor health and women's health. And it really piqued my interest. And I thought, oh, as a woman, this is really interesting to understand more about my own body and these muscles that no one had ever talked about that help with peeing and pooping and periods and pregnancy and birth. So I did a clinical rotation in that, and I said, this is exactly what I want to do. I didn't experience any pelvic floor issues that kind of led me into this field. What I really loved was helping women better understand their bodies, destigmatizing a lot of the issues like leakage or painful sex or prolapse that are common. We've been told are normal. They're not normal, but they're absolutely treatable. And to see their lives transform through therapy was just so rewarding. So I jumped right into the specialty 19 years ago when I graduated and got my board certification in women's health, and then have been practicing ever since. And then about wow, 9 years ago, I started my Instagram account, The Vagina Whisper, just to really normalize these conversations and share some of the tips and tools I knew as a pelvic health PT, but I felt every woman should access.
Thank you. I'm thrilled, and I'm not even surprised that you got this degree at WashU, because WashU is very forward thinking in women's health. In my pharmaceutical job, I interact with some of the faculty there, and they do amazing stuff. So shout out to Washington University, School of Medicine. I don't know if your degree fell under the School of Medicine or something, but yeah, that they're so amazing with what they do for women's health. So I'm thrilled that you went there. And okay, but so the Vagina Whisperer, yeah, when I met you, I heard about you, but I was not on Instagram then. So I joined Instagram about 8 years ago, and you said you started the account 9 years ago, but I think you were known as the Vagina Whisperer before then. Share a little bit about that, because you obviously did something to help women. I think the space I heard it in was for the women who were pregnant. And then
Yeah.
and that's key. People don't realize, as the friend of my mom, her daughter said to me once, your body changes after you give birth. Everything doesn't feel quite the same anymore, even if your delivery was normal. So let's talk about that. Why would somebody want help with this? Why do they need the Vagina Whisperer?
Well, I was given the name by a group of girlfriends, and it was after I had already been practicing, and we would get together for kind of post-college reunions. And I ended up one summer talking to a lot of their moms in the hot tub about their bladder problems. And I was kind of the young one in this hot tub in my, mid 20s talking to them, and they were like, "Oh my gosh, Sarah's like the vagina whisperer." And so that name really stuck. And I started the Instagram account when I was pregnant with my second son because a lot of my friends were asking me, like, what do I do, for perineal massage, or what are the postpartum supports I need, or what do I do for leakage during pregnancy? And so it was really a way for them to access the information from me. And because they called me the Vagina Whisperer, that's what I named the account. And the growth of the account over the years is really a testament. I mean, I have over 750,000 followers. It's really a testament to how much women want and need this information. And we're not getting it in our standard medical care. And it's not the fault of any physician or any program. It just hasn't yet been integrated into, training and education and then practice. So one of the reasons I started focusing on birth and pregnancy is because your pelvic floor and core change during that time, regardless of how kind of quote unquote normal your birth was. Your pelvic floor changes at 6 weeks postpartum. It's functioning at 50% of its pre-pregnancy state, which means you have more weakness, leakage, etc.
Now, why don't we tell our listeners what is the pelvic floor?
Yeah. So it's this basket of muscles that sits at the base of your pelvis. If you think about the bony ring of bones where your hips are and you have your sit bones at the bottom of that opening is literally a floor of muscles, and that's called your pelvic floor. They support your pelvic organs, your uterus, your bladder, your ovaries, your balls in the female body. And in the female body has these muscles have three openings, one where urine exits through the urethra, one for the anal opening for bowel movements, and then the vagina for vaginal birth, vaginal intercourse, and menstruation. So these muscles are involved of all of these things that affect us, you know, daily, monthly, yearly, and during these transitions like pregnancy and birth and menopause. So it's really important that we have proactive education and care when we know these muscles are changing.
True, so true. I mean, the pelvic muscle floor is critical to all the things a woman goes through in life, as you just described. And I didn't even really think about it in terms of, as you said, when you begin menstruation for the adolescent young girl. But there are changes because all those muscles and all the tissue, not so much the muscles, but the tissues are affected by your hormones. And,
Yes.
as the ovaries, the pituitary, everything starts producing things and things change. And then when you hit menopause, things change again and everything changes. It's throughout the whole life. And yeah, good point. Wow. And so I don't even know where to go with this. So tell me more about your latest innovation. I know you've got an application coming up. I want people to know how to reach you in every way possible.
Thank you. So, I am really passionate about helping women better understand their bodies because I feel like we've been living in the dark, and every patient that has come in the door to see me over the past 19 years has said, "Why didn't anyone tell me about this sooner?" And so I think if one, we start educating women younger, when they're menstruating, when they are becoming sexually active, prior to pregnancy, I think that we can start normalizing these conversations because if we don't know what normal is, then we don't know what abnormal is or problematic, and then we don't know where to get help. So we end up suffering in silence for longer. Everything that I've created has really been in response to what women are asking for. So when they were like, "Hey, what do you think about writing a book?" And I was like, "Okay, well, this is something that there are no books out there about pelvic floor health." So I wrote Floored. And then I had people asking, like, what can I do at home? I can't access a pelvic floor therapist, or I just had a baby, or I can't get off of work. So I created an app called the V-Hive, and it has at-home pelvic floor training. So it's not just strengthening exercises, but it's strengthening, it's relaxation if you have pelvic pain, painful intercourse, or difficulty emptying your bladder or bowels. And it has programs for every stage when you are going through changes. It has a pregnancy program with pelvic floor training, a postpartum program, a perimenopause and menopause program, where it really is curated to your season of life and helps you train your body and your pelvic floor for what you need it to do. When you're pregnant, you need this support to help carry a baby. Getting closer to birth, you need these muscles to relax and lengthen for birth. During perimenopause and menopause, you need to strengthen to build up the muscle strength of these muscles because muscles are atrophying every year. So, just really equipping women with tools to overcome pelvic floor problems, but also prevent them.
That's incredible. I'm just like I'm blown away. I'm lacking the words to like tell you how much I admire what you do and how valuable it is. We do need to integrate it into everyday life. We need to educate women. We need to educate physicians, nurses, because and I love your videos. Let me tell the audience, you guys have to listen to her or watch her Instagram videos. No, it's not just about lube and some gross stuff. It is amazing exercises. It's physical therapy. They're exercises you can do in your pajamas. And they're exercises you can do when you go to the gym. And this is all to strengthen those pelvic floor muscles. So you should definitely look her up on Instagram if you're on there. Are you also on YouTube or Spotify or anything?
I don't have as much on YouTube, but I am under the Vagina Whisperer on YouTube. I'm also on TikTok as the Vag Whisperer because TikTok doesn't like the word vagina. And, I think a lot about what I'm really trying to do is, there's no one size fits all exercise. I think the narrative for pelvic floor anything has always been like, do your Kegels, but that is absolutely not the prescription for everyone with a pelvic floor problem. And doing Kegels could actually make your problem worse if it's not the right exercise for you. So it's kind of like saying everybody who has back pain just do a bunch of crunches. Pelvic floor care is much more nuanced than that, and we help with much more than leakage. We can help with, everything from pelvic organ prolapse to abdominal separation after birth to tailbone pain, vaginal pain, painful sex, you know, painful bowel movements, endometriosis. I mean, there's so many things that we really can support. And so the goal is really to get away from this, like, oh, I'm just going to do my Kegels and it will be fine, because that is not the right pathway for everyone. And it could actually do them harm if they're doing the wrong thing.
Never thought about it that way because you're right. Kegels are the only thing they used to teach us. And
Right.
so that is something everybody knows, but there's more to the pelvic floor than just Kegels exercises. Your pelvic floor does control the ability to urinate, have bowel movements. So, or as you said, pee, poop, and for menopause, if your organs start falling out of you, this is important. You can, that might sound gross to some people, or some people are like, I can't believe she's talking about this, but this is real life. And we
It's
women are,
real life. It's real life. And if we don't talk about it, we carry so much shame about it. But, these are injuries and dysfunctions. Like if we have a knee replacement, we can walk around with crutches and a knee brace and everyone knows we're experiencing something. But because we can't see pelvic floor issues, we often suffer silently. But we need to normalize these conversations. And, they don't have to be dinner table conversation for everyone. They are for me. But I think, again, the only way we can get women the support they need is if we start discussing these issues openly.
agree. So how will your app, the V-Hive, help with that? Tell me more about the app, and then we'll close out.
When you start it, you take a quiz. It just takes about a minute or two, and it really kind of walks through like what your life stage is, what your symptoms are, your age, all of those things. And often what we see is clusters of symptoms together are what lead us as therapists to think that you may have tension and need relaxation. You may have weakness and need strengthening. You may have incoordination. You may just be proactive. And then we put you on a pathway of exercises to start with. And, the workouts are not long. They're anywhere from 10 to 20 minutes. They require very minimal equipment. Like I'm not a big gym person, so I want to be able to do these at home. And it's just very accessible. I mean, I think that, pelvic floor workouts aren't just sitting around doing Kegels. It's really bringing these muscles into everyday life, whether it's lifting your kids or grandkids, lifting groceries, lifting weights, teaching you the proper way to activate and relax these muscles so that they can help you lifelong and even sex. I mean, we talk openly about, I have videos on how to progress to intercourse if you're having pain with it, which can be something that affects a lot of older women when their hormones are changing. So just really giving women the support that they need, just like you would go take a bunch of classes for your core, you take a bunch of workouts for your pelvic floor. That's the goal of the app.
I love it. Women supporting women. That's why I'm highlighting you. I love what you're doing. Thank you for doing so much for women and promoting women's health. Everybody, thank you for joining us at this month's mid-month meeting of the minds by Plans Connect with Dr. Sara Reardon, the Vagina Whisperer. You can follow her on Instagram. You can buy her book, which is called Floored, Floored. And in the comments of this post, I'll probably put a picture of her book if you're not sure. And, send her your questions on the V-Hive app, V-Hive, right? V-Hive. It's going to be
Yeah,
an app.
V-Hive, like beehive, but V-Hive, yeah.
I love it. Anything else you want to add?
Yeah, I mean, ultimately, I hope this app is what we can recommend to patients during pregnancy or postpartum or perimenopause so they can really have a roadmap on how to take care of their bodies during those transitions. So that's the ultimate goal, and we'll see how that pans out. And then everyone who tries it can try it for a week free. So it'll just give you a sense of what you can do at home for your body.
That sounds amazing. Thank you so much.
Thanks for having me.